Okay. So, ma'am, we have accumulated a couple of questions, and two which are the most important one I'm asking over here is first question is by the audience is how does protein intake influence muscle strength, bone health, and long-term well-being? And what are the measures one has to take to prevent conditions like sarcopenia?
Uh,
Ma'am,
so,
yeah.
can everybody hear me? Can
Yes,
everybody
ma'am. Yes,
hear me?
yes.
So, a very relevant and important question is how do we maintain muscle strength? How do we maintain um, various comorbid conditions associated with muscle strength? How do we look at sarcopenia and what really is sarcopenia? So, sarcopenia is a very big reality in our culture. And more and more, I look around me, and people as they are getting older, they're losing muscle mass. So it's a progressive loss of your skeletal muscle mass, and that leads to weakness, reduced strength, and performance in every aspect. And I think there's a lot of suffering involved with sarcopenia. And I always tell, it's one of my, again, favorite topics besides diabetes, Neha, is that to talk about what as a doctor I have seen over the last 30 years, where I see people managing till about 55, and then they start withdrawing, they stop, they have ankle pains, they have knee pains, they have back pain, they don't want to go out much, then they end up with surgeries because of joint. So there is a lot of stuff which is could have been saved or gotten better by addressing this phenomenon, which is muscle loss. So let's first understand that till the age of about 40, all of us are in a positive metabolism and we gain muscle. And after the age of 40, all of us start to lose muscle every single day, a certain percentage of a muscle. So what does a person more than 40 years need to do? They need to start thinking that they're going to lose muscle, and they need to start working on building muscle. How many of your family members or how many of the people around you, look around you in the room you're sitting, have even talked about muscle? They've talked about thyroid. They've talked about blood pressure. They've talked about sugar. Is there any discussion in a family on, are we losing muscle? Patients come to me, Neha, and they tell me, oh, my arms have become thinner, my strength is going. And then the discussion of muscle mass arises. So I think somewhere as an entire culture, we are, I'm not talking about the top 0.05% educated, affluent community. I'm talking about India in general. So we need to all understand that muscle mass is one of the most important things to not only what I'm talking about musculoskeletal health, but I'm talking about inflammatory markers. I'm talking about inflammation in the body. I'm talking about chronic disease, like your blood vessels are also held by muscle. So I think the entire sugar metabolism depends upon how much muscle mass you have. So sarcopenia is a progressive loss of that skeletal muscle mass, which is important for literally life as we get older, in every sense of the word. So all of us need to start talking in our circles, looking at videos, understanding what muscle mass is, and try to improve. Now, the question comes is, how do we improve or how do we work with sarcopenia or loss of muscle mass? So number one is to assess with your nutritionist how much of protein is going in your diet in a day. Now, vegetarian Indians, which is a very big community, tend to have much lower amount of protein in their diet than is adequately required. Adequate protein intake is anywhere from from 0.8 gram per kilogram body weight to 1.2 gram per kilogram body weight. And this is across ages. An Indian vegetarian averagely is not getting more than 0.4 gram per kilogram. So there is a deficit every single day of 0.4 gram per kilogram. Muscles are made from protein. Remember that. So if your protein intake is low, your muscle mass will be low. Now, alone taking protein does not build muscle. There has to be action. The protein has to be formulated into a muscle. How does it get formulated into a muscle? By using that protein and working towards it. Now, which exercise promote muscle? So strength and conditioning, using some weights, therabands, Pilates, yoga, so hatha yoga, where you're standing in a particular position and holding a position. And I must say, swimming and skipping and cycling and running, everything builds a certain kind muscle building in your body happens. Those are aerobic and these are anaerobic exercises. So remember that if you do exercise, whatever you like yoga and walking, fine. You like Pilates and walking, fine. You do a little bit of strength and conditioning with your therabands, fine. But remember, even 15 minutes spent in those exercise every single day. Again, I believe in discipline and doing everything every day. And trust me, when we put a time in a day for certain activity and we do it, we might do upper body for 3 days, we might do lower body for 3 days. It is a must. Even when you walk, if you wear 1 kg weights around your ankles, if you wear 1 kg weights around your wrist, and then you walk, you over time will build muscle, provided your protein intake stays between 0.8 gram per kilogram to 1.2 gram per kilogram. So remember that sarcopenia is absolutely avoidable. And that is the one thing everybody should read up on, everybody should understand, and everybody should know that all my problems originate starting from the age of 40 when I start losing muscle and I do nothing about building it or understanding or talking about it. So please, everybody, this is actually one of my favorite discussions. Neha, thank you for asking this question because it will change your life. Talk to your family members, talk to everybody. What have you done today to build muscle? Ask yourself this very simple question. Maybe I'll write tomorrow a post on it. But what has somebody done? What have you really done to build up your muscle today? Today, ask yourself and then go every single day about it. And then you will see. So that is my answer to the question.
Thank you so much, ma'am, for such a detailed answer and explanation. Ma'am, apart from that, there's, I think, always with diabetes, we come up with another major side effect, which is hyperuricemia. And my next question is also on the same. I have collated a couple of questions and made one question for each. So, ma'am, next question is, how does protein affect the uric acid levels? And can a patient with hyperuricemia completely stop consuming protein? Because this is something which is a major concern in among all the patients. And besides protein intake, what are the lifestyle measures that one can take to prevent hyperuricemia?
Okay, we'll divide this.
Yeah, absolutely, ma'am.
Yeah, so that everybody's clear. So the first question out of the three questions that Neha has asked is about is protein linked to hyperuricemia? Very simple. So first, I would always like to explain hyperuricemia. When your blood tests come back, you always come to your doctor and say, oh, my uric acid, what is this? It's a little high. So uric acid, I'll again explain, is a byproduct of breakdown of amino acid in the liver. It is thrown out of your body through the kidney. If it's not thrown out properly from the kidney, it can make these spiky crystals that can go into your toes and joints and give you severe pain and give you something called gout, right? But uric acid is not just about gout. It's not just about crystals. It's not about uric acid stones in the kidney. It's about metabolism. So I always want to look at everything at the root cause level and what really happens with uric acid. So go backwards. Suppose uric acid is formed by protein or amino acids, which are the further breakdown product of protein is amino acid. And they go in the liver and they get converted into uric. But a lot happens in that conversion. It's not just easy conversion. So if your body has higher fat in the liver, fatty liver, the fatty liver comes from triglycerides. Triglycerides are free fatty acid that collect in your liver. Triglycerides are a kind of a saturated fat that comes out of carbohydrate. High fructose foods, they also generate more free fatty acid, which is collected into the liver. This free fatty acid accelerates conversion of amino acid into uric acid. If your free fatty acid level was not high, if you did not have too much fatty liver, your uric acid production would be normal and not excessive. What would happen to then the amino acid? The amino acid would then go to form your muscle, form your cells, form your immunoglobulins, which will fight infection. All that good amino acid that should go to the good area starts to get converted fast into the uric acid because there is so much free fatty acid from. And so anything with fructose, which is sugarated juices, anything which is drinks with sugar in them, simple sugars, carbs, you can have fiber rich fruits, that's okay. But having fructose, that will all accelerate uric acid formation. Now, uric acid alone, the free fatty acid, the triglycerides, everything is also connected to your insulin resistance. Remember that. So all of that is in a vicious cycle where more insulin resistance is happening, more free fatty acid is being formed, more. So what is really a problem with uric acid? Uric acid, if I look at a diabetic or a person who has insulin resistance, I will look at it as a metabolic marker, which means that it is a marker which tells me there is high fructose or free fatty acids or triglycerides in the system which need to be reduced. The protein intake anyway in an Indian is not more than 1.2 grams per kilogram. If I make the protein further less, Neha, they get weaker. Now, there is two kinds of protein. There is an animal protein, which is rich in something called purines, and then there is a plant-based protein. Now, remember this word purine. Purine is very high in uric acid. It makes more uric acid. If you have purine-rich diet, you have more uric acid. So it's a larger substrate to make uric acid. If your kind of protein you've eaten is purine-rich protein. But if you are taking plant-based proteins like legumes and beans and all of that is not purine rich. So if a vegetarian comes to me, has diabetes, has uric acid elevation, I'm very sure it is a metabolic marker of insulin resistance. Their baselines might be high, and if I did an ultrasound, they'll have fatty liver. So it's very clear that their metabolism has to be addressed. So my first answer to the question is protein associated in forming uric acid? It Amino acids get converted into uric acid, Neha, but low purine proteins are not associated with uric acid, while high purine animal fats, too much red meat, too much meat might lead to a uric acid. But the main problem with uric acid is high free fatty acids or fatty liver or fructose rich foods, which we have to be very careful of. Alcohol. Remember, alcohol. I mean, I know you asked me about protein and uric acid, and I'm diverting a bit. I'll go further. So this was the first question. So I hope everybody understands the uric acid is excreted through the kidney. So it's very important that your excretion through the kidney is very good. Your second question, Neha, about uric acid was, should they stop eating
Exactly,
all
proteins, because
proteins? And I again explained to you, you should reduce your purine rich protein, which is animal fat. You should reduce fructose. You should reduce alcohol. alcohol competes directly with uric acid excretion from the body. So if you're taking uric acid, your alcohol will get excreted, uric acid will be held back. So alcohol intake, animal fat-rich foods, and fructose. They are these three main things that you have to remember. You have to improve your carbs, you have to improve your carb intake, you have to improve your insulin resistance. All of that also concentrates. Now, and the third question, Neha,
And
was
what are the lifestyle measures that one has to take to prevent hyperuricemia?
yeah. So the lifestyle changes are very important. Number one would be at least 3 liters of water, if your heart allows, every single day will help you excrete uric acid. Having fiber-rich food is very, very good for reducing the conversion of uric acid. So it's very important that your diet has extremely rich in fiber. Taking simple carbs or fructose-rich foods are absolutely a no-no when you have high uric acid. Alcohol intake, I said already, very important, causes gouty arthritis and pain and gout very. I think sleeping well will come into the picture. Your metabolism gets better, reduction of A1C, getting your fatty liver down, losing your waistline, reducing insulin resistance. All of that is connected. So this is very important to understand that the basic things that I keep telling you, 6 steps, they work for this also. It's very important. Exercises also help in reduction of uric acid, remember. So if you are really doing good amount of exercise, the inflammatory markers, the muscle conversion of amino acid towards the muscle gets pulled, less is available to make uric acid, and all of that really truly helps your reduction in uric acid. So I think we've talked an entirety about uric acid. And I hope that you do not give up your dals and legumes. And please, anyway, you're not having more than 0.4 gram per kilogram. Really, really, today it was really a great day at work because there was a couple, they were older and they came to see me. And, uh, and it was really lovely because they talked to me about muscle. Their son is a doctor in Ireland. And the son told him, you go and talk to your doctor. You both need to talk about muscle. And there I go. I talked a huge lecture, Neha, on muscle building. But they were so receptive. They took sattu from me. They're thinking of the nut powders that I asked them. Then even whey that they were open to taking. And they were like really open. Yes, we're going to listen to you. They are pure vegetarians. And it's lovely to see people above the age of 65, 70 coming to me and talking to me about muscle, because then my work is done, because my whole work is about this. And it's lovely to see that. Yeah.
Absolutely, ma'am. And thank you so much for beautifully explaining all both the topics and really busting a lot of myths here. I think people needed that information and the facts. So I'm sure it's going to be helpful for their lifelong learning. Ma'am, another question is by Mr. Nevin that he wants to understand a little bit about the late night cravings, why it happens, and what are the major reasons. So if you can just give a little bit information on the same.
I think when your circadian rhythm is completely off, your working hours are completely off, the body will demand food at the wrong times. I really believe that once a person comes under circadian insight, I will request you to look at circadian rhythm. What time do you get up? What time do you eat your breakfast? What time do you eat your lunch? God made your human body to react to hormone secretions at certain times of the day. And if a person is not following circadian rhythm, their bodies will ask for food. It's not just, oh, they're asking for food. It's not that. It is because of how we are managing our exercise times, our food times, our sleep times, our work times. When you are in rhythm, that is how your body was made. It automatically starts to shut down after it's dark. It asks for sleep. There is a melatonin hormone. There's a growth hormone that starts to build in new cells. Every single part of your body is starting to rejuvenate. I can absolutely see a person who's out of circadian rhythm, and I can absolutely see a person, Neha, who's in circadian rhythm. There is a amazing freshness about them because they value the sunlight, they value their hormones that come, they eat on time, they sleep on time, they do everything on time, and their bodies start to adapt. And after 9 they do not feel hungry because their body is actually shutting down. But it is a habit formation that we have done. When we keep giving a stomach or a brain food that they demand out of you at whatever time because we call it a craving, then it becomes a habit. And habit is very difficult to break. Only when awareness seeps in, when you are ready to accept that I am going to get up at a certain time, I am going to exercise at a time, I am going to eat at a certain time, and I will not give myself. And trust me, if you put yourself into a habit of asking for food or ice creams or late night eating, your body will demand because you have given that habit. It never came to you, it was given by you. By becoming aware about it, becoming mindful about it, by slowly taking it away from yourself, you can achieve. And trust me, the first 21 days are not easy. And that is why you need somebody in your life who supports you, becomes your health companion, takes you, replaces things like soft to chew when you're having a craving, giving you pumpkin seeds to chew when you have a craving. But you have to be mentally ready for the change. You have to be mentally ready to accept that I have given this habit, I can easily pull this habit away. It is not a drug. We are not addicted. It's just food. We can take it away.
Thank you so much, ma'am. Ma'am, next question is by Vishali ma'am. Uh, does the sugar spikes when one is unhappy or stressed?
Yes, Vishali.
Like,
Absolutely.
ma'am,
That's
can
a
you tell a little bit of logic behind it, why it happens? I think just in a short.
yeah, absolutely, Neha. Everybody should know that. So when we are unhappy or when we are upset or we are angry, there is a trigger of the stress hormone release in our brain, and that's cortisol, right? And the adrenal glands also secrete that in the body. Now, this cortisol is directly responsible for increasing hyperglycemia. Cortisol, like in asthma, people take steroids, or in COVID, also people took steroids and their sugar levels went up. This is being making steroid inside the body. Cortisol is like steroid in the body, and that leads to hyperglycemia. I think people need to learn to process stress. Okay. There are counselors that you can talk to if you're open to. There is your journal you can write into. When you write, it gives you a different perspective. When you talk to someone, it gives you a different perspective. All you need at that time is a different perspective. And instantly, something with that inside you, you can feel calms down. Your heart rate reduces, the breathing starts to slow down. Uh, Avoiding it or not addressing it will not go away. It just builds up. So it's very, very important that people understand that there is a journal, which could be a person listening to you, where you can write everything down. And when you read it, it gives you a different perspective. Or if you can have someone, a counselor, a registered counselor, give you advice, then you can do it. So it's very important for Vishali for you to realize that, yes, but if I were you, instead of looking at the sugar numbers, I would look at the stress. Instead of finding a reason for the high numbers, I would look at the stress and what it's doing to me. Is it not letting me go to the gym? Is it asking me to go open the fridge and have some mithai? Is that stress doing something to me which is causing the sugar levels to be high? So if I were you, I would not find an answer for the higher levels or look at the levels. I would find what this stress does to me that makes me go and maybe consume something or not exercise or just not want to step out because I feel depressed, which causes the sugar levels also to go up. And that is the part you can correct. So good luck, and I hope you understand.
Thank you so much, ma'am. And thanks, Vaishali, for asking this question. I think now people will be open to discuss it with their counselors. So, ma'am, next question is by Mr. Pavan. He wants to understand. He's a little bit concerned that increasing on the protein can and less carbohydrates, can it accelerate gluconeogenesis? Can you throw some light on it?
Pavanji, I don't know. I think this is a knowledge which comes through Google or ChatGPT, because gluconeogenesis is a syndrome that until your liver feels that you're hypoglycemic, okay, which is a sugar level of less than 70, which I think is even less than 60, your liver doesn't kick in to break down stored sugars in your liver called the glycogen and pump it into your blood, which is genesis of sugar by the liver. On feeling you have hypoglycemia. So I don't know where protein intake would cause. I don't understand. So the question doesn't have link. Please take your protein up to 1.2 grams. That is why there is a range. And we are not giving you 2 grams per kilogram. The range is 0.8 grams to 1.2 grams per kilogram, which is a range, which is a safety range. Carbs, we all need to move to complex carbs, fibers. The carb in Indian diet, Mr. Pavan, will anyway come. आप उसको count करें या नहीं करें, the carb will come. Please count your protein and build it up to 1.2 grams per kilogram. Again, as Neha asked a beautiful question, called uric acid. I already stand ground that animal protein has very high protein and purine-rich protein, which can give you uric acid. So neoglucogenesis is a very, very different phenomenon. Does not happen until your sugar levels are below actually 50. Rarely. I hope you understood.
Thank you, ma'am. And there is actually a myth, and everyone feels that, okay, if we are not eating grains, we are not adding up the carbohydrates. So I just tell you that, whatever you are eating, all plant-based protein, food have the carbs, and you cannot even
Fiber
make
is
a carb.
also a carb. It's an
Exactly.
insoluble carb, but it is a carb. So there is carb.
Absolutely. Another question is from a very interesting person, interesting name, I would say, Mr. Virus. So he feels
Mr.
that
Virus.
virus.
ये तो नाम आप मत रखिए हाँ, but anyway, चलिए.
Okay, so he feels that his eye power is increasing. Does it have any link with the diabetes? And what precautions one should take, and how frequently one should check on the eyesight to if the person has diabetes?
So eyesight needs to be checked yearly along with retinal check, which is the film in the back of the eye where the images are formed, your vision happens and the optic nerve starts. So the retinal clouding starts happening in diabetes, and it's very important because there are deposits in the retina, and that needs to be checked every year. Vision indirectly can get affected, but is not a very big part of diabetes. But glaucoma, which are high pressures from the retinal artery gets a little pressurized, and that causes you to have pain in the eye, which is glaucoma or higher pressures, can also be a complication of diabetes. Glaucoma is the biggest cause pan-India of blindness, not only diabetes. So you need to see an eye doctor every year, check your pressures of the eye, check your vision, and check your retina, which is very important.
Okay, ma'am, next question is by Mr. Rupesh that if anybody is on steroid, does it has any impact on the muscle loss?
Absolutely, it can. So there is a breakdown of muscle also with steroid use. So if you're taking steroids for prolonged periods, it can cause muscle damage, yes.
Thank you, ma'am. And the question is by Manali, but I think Manali proteins have to be taken after the workout, so I think I will take it up.
30 to 60 minutes after a workout. It's a good time. You have up to an hour after your workout to consume protein. It's a good idea that you've worked out your muscle and now you're pumping them with the substrate to build muscle, which is protein.
Thank you, Mr. Harivansh. Mr. Harivansh has written that communication of the speaker is very effective. It gives hope to the viewers. So thank you so much.
Thank you very much. One thing I needed to also add here is that try and split split your protein throughout the day. Every meal requires certain protein. It has a role there. It has a role of metabolism. It's very important to not build up the protein in one part of the day. So please split that protein that you take. Don't think that, oh, I took a glass of whey in the morning for 25 grams and it was in a milk which was 10 grams. And then I had an egg along with it. That's another 10 grams. And that is not the way you take protein. It's a very important thing to understand that protein needs to be spread out through the day. Your coach, your nutritionist will be able to beautifully space it out for you. And there is a need for you to understand why protein needs to be spaced out.
Absolutely, ma'am. The next question is from Mr. Swaminathan. Can collagen be the substitute for the protein supplements or the protein powder?
Neha, I have to let you answer that. I'm not that good at this answer. I'm sorry.
So collagen is actually not a replacement for the protein supplement. It is more required for the skin health or for the joints pain if somebody has. But if you're looking for building on the muscles, whey protein or the pea protein, these are much more helpful. So please go with that. And it all depends on the, objective behind taking the protein powder. So
Thank you, Neha.
I hope it is clear.
Mhm.
Okay.
Yeah.
Okay. And there are many times it happens that, due to diabetes, we have observed that people are losing on lot of weight. So there is a question from Rashmi that she's very concerned. Her father is 76 and losing on the weight very rapidly. So what is the reason and how can he start doing the muscle training at this age?
Rashmi, you can do muscle training first and foremost at any age. It has to be age appropriate. A good physiotherapist, a good trainer would always design a program according to the age and capability of a person. That's why we call it personalized and precise management. So up to 90, everybody should spend some time in the day, some sort of physical exercise to build muscle. So absolutely your father can do it. He's not my patient, so I don't know. But let me tell you that when diabetes is uncontrolled and the levels are higher than 8.5%, your body does not utilize sugar for energy, which is in your blood. It starts saying, I need energy, but I can't break this sugar down because this insulin is not working and the sugar is lying in the blood. So what does the body do? It starts breaking your good protein. It starts breaking the fat, good fat in your body. And it starts using that as a source of energy because we all need energy. So what happens is we start looking haggard, our muscles start disappearing, we look like we've been sick for months, and I think that leads to a catabolic look, which we call as haggard look. And I think you're concerned about your father. There is a test for that everybody should understand available for you to assess your muscle mass. I can't just leave you to talk about muscle mass, but there is no testing to available. So there are two kinds of testing available. One is actually three kinds. One is a very simple caliper method where they check your muscle mass, very crude and is not that sensitive. Then there is a second method in which we do plethysmography, and in that you stand on a machine and you're holding on to something and you're giving pressure from your arms, and that also gives you a good muscle versus bone versus water in your body kind of a structure and everything. And then the third way is through a very specific radiological scan called the DEXA scan, which also gives you very intense and most sensitive and specific muscle. I would say the middle method is very easily available, at least in all the cult gyms, they are available. And I'm sure there are many gyms that is available. And that gives you a printed report that you can talk to your nutritionist or to your doctor and then sort of for your own self start comparing where you go with your muscle. I think just how I say LDL is 120 today, 140 tomorrow. We should have some analytical ways of measuring muscle or educating ourselves. What does it mean to have lean muscle mass? So I think doing those tests and then following them through is very important.
Absolutely, ma'am. Ma'am, next question is that by Vishali ma'am, that what is edema and how to reduce the swollen feet?
Edema. So swelling in the feet can be swelling in the hands too, and it's edema. I actually, Neha, hear a lot of it in summer months. As summer starts to progress, we start to retain salt and we are sort of not that well hydrated, and as a result of it, our kidneys are not flushing very well. And in a normal person during the summer months, really their feet get swollen by the end of the day. In a normal person, I'm telling you, and their hands too. And this is, I hear this complaint constantly in summer months. I tell people to drink a lot of water, reduce pickles, salt, papad from their diet, elevate their feet whenever they can, and they will see with gravity in the morning when they get up, they don't have an edema, which means that your liver and your kidneys and your whatever organs you're worried about, the heart, they're all normal. Because in the morning, if you're normal, that means that everything is working fine. And there's some electrolyte, which is an issue which we can all manage. So watch the salt, increase your water intake, don't take pickles, don't take poppers, avoid anything salty in summer, and your feet, raise your feet up. Sometimes as we gain weight, and there are pumps in our legs, natural pumps that pump the impure blood back to the heart for purification. Those are called veins, right? Now, with heat, anyway, the artery and veins have dilated a little bit. So thoda water is coming out. But if our perforator or our pumps in the legs are not working well, they are not able to pump that excess water or in the veins back to the heart for purification. What happens? You get ankle swelling, you get feet swelling. And it is a mechanical problem. It is not your kidney, it is not your heart. It is a mechanical problem. What do? You get support or varicose stockings or support stockings. You pull them up and you sleep with them at night. In the morning, your ankles are all thin, your shoes are all thin. But what really needs to be done is to develop those muscles in those calves, the perforators, the hamstrings. You got to understand how muscle is very important in some, otherwise you're going to have a lot of swelling. So my suggestion is that not every swelling is heart. Now I'm going to come to the third part, the swelling, which is worrisome. So there is edema or swelling, which is around the ankles, feet, going up to the mid legs. And that could indicate that your heart is not pumping very well or your kidneys are not filtering very well. Then please go to your doctor, and they can do simple tests like echocardiogram for your pumping of the heart, a simple creatinine BUN test for your kidneys, and they can do a Doppler or blood flow test through your legs, and you can instantly find out that it's the circulatory problem and it's not the heart or the kidneys. So I hope I've explained all three aspects. And basically, I have seen what really works is drinking a lot of water, elevating your legs, sometimes at night wearing support stockings, not taking salts, not taking pickles and poppers, and drinking a lot of water.
Thank you so much, ma'am. The next question is by Miss Madhavi.
By the way, this was a great question. I don't think it's been asked before, and I really think that it's an essential question. Thank you for asking.
Absolutely. The next question is by Madhvi ma'am. She just wants your opinion and suggestion what she should do. So she was earlier on the metabolic neuropathy antibiotics, and since then she has not.
Metabolic neuropathy, what is that?
Yeah, she's saying that she was induced with the drugs for metabolic neuropathy antibiotics, which was used 16 months back, and since then she has never got the normal levels. And what she should do,
What is normal level?
ma'am,
This question is very incomplete. Let me tell you how to complete it. First of all, there is no diagnosis like metabolic neuropathy. There is diabetic neuropathy, idiopathic neuropathy, alcoholic neuropathy. There are many neuropathies, but there's nothing called metabolic neuropathy that I know of. Number two, there is no antibiotic ever used for a neuropathy. So there has to be a special medication which could have been used for neuropathy. So I would love to help you, but this question doesn't make any sense. You'll have to write properly and maybe even scan your prescription, but this is not a question.
ma'am, she just wants to know like which doctor she can refer to for the neuropathy related concerns.
See, dear, if it's your neuropathy in your legs, I would send you to a podiatrist actually. A podiatrist are feet or foot surgeons who actually see the circulation and the nerve related neuropathy in your legs. They do tests like There's a fine thread-like thing they touch you. They do a NCS nerve conduction study. They do Dopplers, and then they decide, is it true neuropathy, heat or cold neuropathy? If there is a diagnosis of neuropathy, you might have to take medication, but the right doctor for leg neuropathy. Now, suppose if your hands have neuropathy. I again think you going to your physician would be the right choice, not a neurologist, because neurologists really, I'm not sure until and unless you have the NCS test or the nerve conduction study or you have a Doppler, everything proves that you have a neuropathy. There are tests to prove. The same medication can be given by your physician or your podiatrist. But if you still want to see a neurologist, neurologists are brain medical doctors, you can still talk to them.
Thank you so much, ma'am. And there's another question from Rupesh that he wants to know. Sorry, Mr. Sushil. He wants to know what is your thought about sugar-fed protein powder, whether it is advisable or helpful or not.
Absolutely. I mean, it's a plant-based protein powder. It's got a lot of seed mixes. It's good for you. It's low in purines, and I think it'll help you in many other ways also with omega-3, omega-6s. So yes, it's a good protein powder.
Thank you so much, ma'am. Another one more question from Mr. Rajal, that he's very disappointed because there's a big difference between the CGM and the glucometer. Ma'am, people keep worrying about the difference. I just want you to give a little bit clarity on both.
Yeah, very much so. Continuous glucose monitor is a device that you wear on your arm for 14 days. It's a sensor, and it is in the interstitial fluid, not the blood. It gives you a trend of 24-hour sugars for 14 days. It is best used as a trend and not as a number. The glucometer reading is a number. It is blood, directly measuring sugar in the blood. Now, I'll give you an example. You eat food, and the food goes to your intestines, gets broken down, absorbed into the blood, and that's what you check in a glucometer. But it has to go through multiple other processes before that same level electrolyte or blood or the fluid reaches the interstitial. So if I were you, Mr. Rajat, it's CGM, I truly believe, and I just came from a conference where there were 100 lectures, but I'm telling you, people are changing their lives because of this one equipment. I really believe that if you were to leave that at whatever point the sugar reaches here, if it was reaching here, it was 120, and if it reaches here, it was maybe 80. I don't know, right? I'm going to see my trend from the 80. So if it was 80 pre-lunch, it should not be more than 40 points extra by a meal. I am going to check something. The problem that happens is when we start confusing ourselves and we are checking the glucometer, we're checking the sensor. For 14 days, my suggestion would be just assume that you can add 20% to that number if you want to in your head. But remember, that when that number is the one which is going down and up, and it's the same number that you're comparing pre and post exercise, pre and post diet, pre and post sleeping, this is the number that you're following. A glucometer is a point number. You cannot do 9 checks a day. Even if you did 9, you still could not get a trend. So instead of being disappointed, understanding the science behind it, that this is blood, that is interstitial fluid. By the time a blood becomes the interstitial fluid, it goes through multiple tissues. So much sugar actually leaves it that the level has to be different. But are we comparing this through and through for 14 days? Or sometimes we do this, sometimes we do this. We can't. We will get so confused. So my suggestion, and I hope that today you have understood it, and you will beautifully manage through your trends of CGM. 60,000, 65,000 nearly patients. And I cannot even tell you that when I present a paper that says that in 14 days, So many people changed the trajectory of their diabetes because they followed it. But the people who got completely confused, one time glucometer is right or one time that is right, are unable to process it. So my suggestion to you is, while you wear CGM, just follow the interstitial fluid. That's a totally different compartment in your body. It is not your blood.
Thank you, ma'am. Ma'am, another one more question is that, people want to know, like, if, we are not eating the meals on time, how much impact it has on the metabolism.
Absolutely, it messes up your complete metabolism. So people who do not eat, so again, we don't regulate our body. The problem is if we start thinking we regulate the body, I can make it get used to eating at midnight. I can do this. You do nothing. You have no control. You were created by the creator. The creator gave this body and the brain and the hormones and how we evolved. I believe in the creator. Some people believe in science, whatever. But that creator gave you in a microcosm or a cosm where there was sun, there was darkness, and your entire body's phenomenon or hormones or secretions were regulated by sunlight and night. There is that flexibility in which during the daylight, suppose let's say 6 a.m. to 6 p.m., 12 hours, a person decides, I'm going to have only 2 meals. Fine, 2 meals, daylight, your body does well, no problem. Now the person says, oh, I only have 2 meals. I've heard that insulin secretion goes down if I eat twice a day, but I'm going to eat 6 p.m. and I'm going to have at 2 a.m. in the morning. I'm doing my IF here. It's terrible. You do not have those hormones that will metabolize food beyond a certain point. So people who take calories after it's dark, their insulins do not work. Their bodies are shutting down. Their melatonin hormones are working. Their growth hormone for recreation of tissue is working. You cannot expect the insulin to come and help you digest that food, which is not happening. So if you are not eating at regular intervals or giving small quantities of digestible food to your system, which you understand your insulin systems can work, you will mess up the metabolism. So please stay with the daylight. That's what I say.
Thank you so much, ma'am. Ma'am, just one more question, that since it's a holy month of Ramadan, I just want you to give some suggestions, or if you have any tips for the people who are celebrating the Ramadan month.
So Neha, I'm very, very proud of so many of our clients who are doing Ramadan. And I'm not only proud of them, I'm very proud of our coaches, our education systems, our awareness promotion. I am very proud of you doing all the community activities. Somewhere something had sunk in. I'm not seeing that much of crazy numbers, and I'm very happy for that. And I congratulate each and every one of you who has taken the awareness. So Ramadan, basically at Sehri, you have a meal, and then at Iftar at 6:30 after namaz, you have a meal. People who are on insulin, a lot of our patients have understood that they should not be doing a 12-hour fast, and they are managing beautifully because they understand that it is not asked of them to fast if they are taking insulin. But there are patients who are doing oral medications and they are so wonderfully understanding. They've talked to their doctor, the dose reductions have been done. They've been told that at Sehri they can take their first dose, and after the iftar they can take their second dose. Even in iftar time, you don't have to have pakoras and purine-rich animal fats. You can have food properly. Instead of, so what usually happens is that they do namaz and they do eat something at iftar, and then later they'll have a family dinner very late, which is terrible. So what I have asked and what SugarFit stands by is that why don't you just club everything at 6:30? At least you still have some insulin that will digest that food from the natural sources. So our standing is that take your meals, whatever you eat, and try to eat as healthy as you can and have it at one time. and then you can have food at Sehri, whatever you have. So I think I wish every single person here blessed Eid, and may your families and everybody find peace and joy and togetherness at this Ramadan and stay healthy is my wishes for them.
Thank you so much, ma'am. I think with that, we will move towards our 6 steps, which people are waiting for. And thank you so much for addressing all the questions. I know it was like we are exceeding with the time, but I think people are very
So
happy.
I will do my 6 steps a little too fast today, but they are needed because all of you need to follow them. And I hope that this will be your guiding light throughout always. The first step is making sure you're accountable, you're checking your sugars. You do the way you want to do, but make sure that you are aware every single day what your sugar is staying at. Do at different times. I would suggest post-meal sugars are very important because that tells you exactly what was not right in your diet. And it gives you a direction to correct yourself. It gives you a learning to correct yourself. Step 2, eating salads before food. Any meal, it could be breakfast, lunch, or dinner. All 3 meals have to be started with raw food. Meal sequencing is one of the most important part of keeping the glycemic spikes after meal down. Step 3, sleeping 7 to 8 hours at the time when your hormones need you to be in deep sleep to come out, which is between 10 to 2 or 10 to 6. Step 4, follow your circadian rhythm. I have spoken enough about circadian rhythms today. I hope you guys got it. Step 5, exercise regularly. Make sure it's a combination. It's not one type. Just don't do sair or walk only. Please work in the gym. Do some Pilates, yoga, strengthening, weights, little, and walk also. And enjoy your exercise. And step 6, as Neha is rushing us through it, is meditation and mindfulness. This gives you that strength of being aware of how you want to live your life. Hear the voice within, making that voice inside you very, very strong. It tells you what is not right for you. It tells you what is right for you. Just follow that and live a very healthy life. And I think this was a great session, Neha, and I've really enjoyed the questions, and I really thank you for asking those questions.
Thank you so much, ma'am. It's my pleasure. And thanks to all the audience. I think they are the one who are asking these questions. I'm just giving them a voice. Thanks a lot for giving, time to India Talks and joining us every week. We are very, very glad that you are joining us and giving us so much love. Have a wonderful evening. Thank you so much and wishing you a very night and pleasant evening tonight. So please take care and make sure that you remember the 6 steps. Don't forget about it and all the pointers. And thank you so much. See you next week with the Hindi
Good
session.
night. Good night. Good night,
Good
everyone.
night.